Good morning, everyone, and thank you for joining us today. Today, I want to provide an update on the COVID-19 vaccine testing effort in Pennsylvania. First, let's run through the latest COVID-19 vaccination numbers. Vaccine providers in Pennsylvania administered more than 5.7 million doses. That puts Pennsylvania 12th among 50 states for first dose vaccinations. So far, more than 35% of the state's population has received at least one dose. That's 3 percentage points above the national average of 32%. Over the past 7 days, providers in Pennsylvania have administered an average of 86,600 doses per day. This week, Pennsylvania is receiving 442,310 first doses of vaccine from the federal government. That is the highest weekly allocation since vaccine became available in December. That's also a far cry from January, when Pennsylvania was receiving about 125,000 doses of vaccine per week for more than 4 million eligible residents. That's why we could confidently open eligibility now to approximately 1 million Pennsylvanians in Phase 1B so they can begin making vaccination appointments. Remember that eligibility does not equal immediate vaccination. It means you are eligible to schedule an appointment to get your vaccination from a local provider. Currently, there are 235 vaccine providers receiving doses from the state allocation, plus approximately 420 retail pharmacy partners receiving vaccine directly from the federal government. All of those locations can be contacted through the Department of Health's online provider map. Throughout the vaccine rollout, we have heard from residents, local leaders, and providers who were frustrated when there was not enough vaccine available. It's a good sign that demand for the vaccine remains high here in Pennsylvania, because the more people who are vaccinated, the faster we can stop the virus. Another important step in stopping this virus is the availability of COVID-19 testing. We know that the number of COVID-19 cases in Pennsylvania and across the country has been on the rise. That's proof that the virus is still present in our communities. While we know vaccine providers are working hard to get the vaccine to as many people as possible, as quickly as possible, we need people to continue to be vigilant with mask wearing, hand washing, social distancing, and seeking a test if they are exposed or experiencing any of the COVID symptoms. We also know that testing is the most effective way to identify and contain the virus. That is why the department has invested so much time and energy in making testing widely available to anyone who wants it. To accomplish this mission, the department contracted with AMI Expeditionary Healthcare, better known as AMI, to perform pop-up COVID-19 testing in counties across the state since September. Initially, we tested over 18,500 residents in counties with the highest positivity rate and outbreaks between September and November 2020. We extended that testing initiative with AMI to provide regional testing across the Commonwealth, focusing on regions without their own health department. We actualized this goal over a 12-week period between December 2020 and March 2021. AMI provided testing for 61 counties in 5 different regions: Northwest, Southwest, North Central, South Central, and Northeast Pennsylvania. A total of 41,250 residents were tested through this regional testing initiative. Breaking the totals down by region, 5,265 patients were tested in the Northwest, 5,995 patients have been tested in the Southwest, 4,964 patients have been tested in the North Central region, 9,061 patients have been tested in the South Central region, and 9,941 patients have been tested in the Northeast. After the regional testing initiative was completed, we extended our contract with AMI to perform more targeted and long-term testing sites. Despite the number of cases rising, we're seeing the demand for testing decrease. We need to redouble efforts to increase the use of testing even as we ramp up the vaccination process. To help with this effort, the U.S. Food and Drug Administration has been issuing new emergency use authorizations for over-the-counter tests, which makes testing much more accessible. Here in Pennsylvania, colleges and universities have been performing a lot of testing of students at the start of each semester and throughout the year. Testing initiatives for K through 12 schools are being prioritized next. Meanwhile, the Department of Health responded promptly to a COVID-19 outbreak in Susquehanna County last month by sending AMI to Forest City School District to help contain the spread. At the same time, the department has deployed AMI to Blair, Dauphin, and Luzerne counties to set up long-term testing sites. Luzerne County's testing sites have been unique in that the majority of the sites have focused on bringing testing into high-rise senior living communities. These high-rise sites have been set up since March 9th to make testing accessible for seniors who do not drive or do not have access to transportation. To date, over 300 individuals have been tested at 16 different senior living facilities. Luzerne also had a week-long pop-up testing site for the general public during March. Currently, AMI is deployed in Center, Dauphin, and Delaware counties. Recognizing the high demand for COVID-19 vaccine information right now, we're also providing counties with digital copies of educational COVID-19 vaccine handouts that can be printed and shared with residents when they visit a testing site. From March 2020 to date, the department has received nearly 12 million polymerase chain reaction PCR test results. And from May 2020 to date, the department has received over 2 million antigen test results. Overall, the total number of tests reported to the department is over 14.3 million since COVID-19 testing began in the Commonwealth. The number of Pennsylvanians who have been tested by PCR or antigen tests is 5.5 million, which roughly equates to 43.1% of the Pennsylvania population. Please note, some people may have been tested more than once. Remember that testing is important to stop and contain the spread of COVID-19. If you know someone who has been exposed or experiencing COVID symptoms, please encourage them to get tested. Now, I'd like to shift topics to provide a brief update on the Your Turn tool. So far, more than 472,000 Pennsylvanians have registered by providing their contact information in the Your Turn tool. As of March 30th, 24,394 folks are eligible in Phase 1B, 27,644 are eligible in Phase 1C, and 27,806 folks are eligible in Phase 2. While Your Turn does not schedule people for a vaccine appointment, you can search for providers nearest you using the new zip code search feature. All individuals who submit their email address will continue to receive future updates related to vaccine opportunities. This will be useful for everyone in Phases 1B, 1C, and 2. When it is your turn, you will be directed to how to find a vaccine provider, and in the meantime, we're working with vaccine providers to connect eligible people to vaccine opportunities. For example, everyone in 1B who has submitted their information to Your Turn should now have received a message yesterday that it is now your turn. We thank you for what you have done so far to fight COVID-19 and ask that you keep up the hard work during this critical turning point of the pandemic. Thank you, and I'll now turn to questions.
Thank you. Now we're going to take questions by raising hands, and we're going to take one question each. So our first question is from Deanna Durante at NBC 10. Give me a moment here, and you should be able to unmute, Deanna.
Good morning, Lindsay. If I can just ask, with the opening up of 1B, we're still hearing from many providers and counties here in the southeast region of the state that they are still backlogged on 1A. So isn't opening up 1B now just creating more work for already overworked and under vaccine provided providers?
Hi, Deanna. Thanks for that question. So at this point, our focus is on making those appointments. Again, we want folks to make the appointments, and we understand that we're still waiting on those allocations to come through. I'll also note that Southeast counties should expect extra doses this week to make up for some of that disparity.
Thank you. Next, we have Grace Griffithton from Fox 43.
Hi, thank you for taking my question. Related to the vaccine, we know that Pfizer's immunity lasts for 6 months. What can you tell us about if people will need a second round of vaccination moving forward?
So we are working and we follow the guidance from the CDC to determine what makes sense in those cases. We also will be taking guidance from our federal partners to identify. And again, testing continues to happen with our federal partners and with partners at the CDC. So we'll stay tuned for those updates.
Next, we have Crispin Havener from WJAC.
Thank you. A little switching gears. We've heard in the past couple of days about the concerns of schools and some of these new variants. There's been a lot of the health experts have been talking about how some of these variants have more impact on children who previously have not been some of the main concerns with the virus over the past year. Talk to me a little bit about your concerns about this going forward, because we are there's been the success with getting the teachers vaccinated, but now we're concerned about the kids. And also, I know this was discussed a little bit last week, but some of the issues you guys have had with determining what these variants are as they're coming into the population.
Yeah, thanks, Crispin. That's a really important, great question. So we continue to, again, monitor those variants with the CDC. I believe there's, as of this morning, 661 in total between the UK and South African variant. We did just receive federal guidance as well to start prioritizing and working through testing in the K through 12 space. So we'll continue to work through that and figure out what makes sense there. We also are working closely with schools because, again, schools must implement safety measures to protect students. And we also, on a personal basis, just want to continue some of those personal accountability measures, hand washing, mask wearing, social distancing, et cetera.
Next, we have Flora Pastorero from penwatch.org.
Hi, good morning. Given the fact that there have been so many changes now, what is the new timeline, not just for all Pennsylvanians to be eligible for the vaccine, but when all Pennsylvanians will actually be vaccinated?
Hi, Flora.
What's the new time?
Good to hear from you. So we are again working with federal partners. We recently received guidance that the Biden administration wants to get folks vaccinated by the end of the month. So we continue to work through our allocations. I think it always goes back to the volume of vaccine and also hesitancy. So it's really incumbent on us to work with our providers at the local level, ensure that we're doing that community education on the vaccine.
Next, we have Jim Melwart from KYW News Radio.
To go back to kind of go off Deanna's question, with the counties, especially here in southeastern PA, that are still trying to get through 1A, I know J&J is, there's an additional help, but what else is being done? Because there's still a significant number. We're hearing that from every provider that it's going to be a logjam now, even, with the additional eligibility, trying to finish up the 1A, especially the hard to reach 1A. So specifically, not just talking points, what's being done?
Sure, yeah, so we're working with the Department of Human Services to reach some of those harder to reach populations, as well as working with the Department of Aging. You may remember a few weeks ago with the Your Turn tool, we were sending out messaging to those folks. The Southeast counties are now able to schedule out, in advance so that they can mitigate some of that backlog. So again, we're just continuing to work with those providers, understanding that our distribution, all of this relies on the distribution and allocation we receive.
Up next is Brett Schultzis from WITF.
Good morning, and thank you. I spent some time at restaurants last week for a piece of reporting on them expanding service. We know cases are trending up. We know restaurants expanded service and more people are going to them. And we know CDC says restaurants are considered to be the single highest risk environment for spreading the disease. I wanted to ask you to respond to kind of a comment from a reader about that story that I produced recently, saying it was, quote, unconscionable to lift restrictions without giving those employees access to the vaccine, knowing that they're in close contact with so many maskless people throughout the day. What are your thoughts on that? And is anything incorrect in what I said as well?
So I think the rollbacks that you've seen on mitigation were incremental approach to get the economy open back up. We're continuing to work with local businesses to help with guidance and to ensure that folks are taking the necessary precautions. And again, it goes back to restaurants needing to have those safety precautions in place to protect their employees and the general public, maintaining, again, those personal accountability measures.
Next is Jamie Martinez from Spotlight PA.
Hi, good morning. Can you give us an update on contact tracing efforts? If cases are going up, I guess we would be getting more information and more data from those cases. Any patterns emerging? Are we able to keep pace with contact tracing now that cases are going back up? Just a general update on our efforts in that area. Thank you.
Good to hear from you, Jamie. So we're continuing in our contact tracing efforts. We still have our just under 1,000 staff on board to maintain those efforts. We've also seen great success with the case investigation questionnaire that we send out to folks online. The folks within the 19 to 64 age bracket are able to fill out that survey online. And some of that has helped with the stigma and with collecting the information about contacts. So that work is in place and ready for whatever it might need to be.
Up next, we have Sean Hamill from the Post-Gazette.
Hi, thank you for taking a question. Can you tell me what the status is of the data you've collected via the survey to nursing homes? Will you be releasing that soon? If not, why not soon? I've been told via email from your press office that they're waiting to collect all of the data, which is unusual because, as you know, in any given week, you've had at least 100 nursing homes that don't report COVID cases and deaths. So I wonder why it's taking so long to report this data by facility when you have not waited to get every nursing home to report COVID cases.
Sure. Thanks, Sean. So the data that we do have available is available on open data. So you are able to see by facility that data. And unfortunately, that survey is not yet complete. And so we're waiting for that survey to be completed before sharing additional data there.
Up next, we have David Kaplan from WTAE.
We've obviously seen case numbers continue to go up in Pennsylvania. We've spoken with some experts here locally that have talked about kind of with the vaccinations ramping up, decoupling case numbers from hospitalizations. We're obviously there is a lag in the hospitalization and death data, but I'm curious if you're seeing anything on the state level that might be concerning regarding hospitalizations, the possibility of a fourth surge that is being talked about, just kind of where things stand in Pennsylvania regarding the rising cases and its potential impact down the road.
Yeah, I think that's a great question. And I think, again, that's why we're really focused on testing right now. Testing is so important to understand what's out there and where the virus exists. So I think it's important for us to be looking at that and to ensure that testing is happening across the Commonwealth.
Next, we have Tom Lehman from WGAL.
Lindsay, thanks for doing this. I wanted to ask about the efforts to reach seniors and homebound people. I know that Deanna had wanted to follow up on this as well. And my question is, what are you specifically doing when you're talking about working with the Department of Aging? Because I think we've heard that from you, we've heard that from other people, and I think we'd like to know a little bit more.
Sure. So the Department of Aging, we've been working with the local AAA providers to ensure that individuals who need assistance with scheduling appointments, either through Your Turn or another form, are able to do so with the local support of their AAA. We know these are trusted providers that folks count on within their communities. So we've worked really closely with the AAAs to maintain kind of a really close look at those call-ins to make sure that we have enough capacity to handle those. In terms of homebound individuals, I know we've also been working closely with the Department of Human Services, as well as their managed care organizations underneath that agency, to ensure that we're reaching those hard-to-reach populations, specifically those who are homebound. And we'll continue to ramp up those efforts and keep them going as long as we may need.
Thank you. Up next, we have Nicole Brambilla from Lancaster newspaper.
Thank you so much for taking my call. Sort of dovetailing off of that last question, do you know how many homebound seniors there are, and when you started working with the local AAAs? Because in mid-February, they hadn't even compiled a list of who might be needing services beyond what could be done, online.
Yeah, so that's I don't know if we had that data today, but I do know the local AAA work started last month, and I know that we, again, work closely with the Department of Human Services to ascertain where those folks are so that we can get to them as quickly as possible.
Okay, we can take second questions. I know there's a couple in the chat, so if you want to raise your hand, we can get those answered. And I see Jim McGinnis, you have your hand raised next, so we'll go ahead and take you.
Thank you so much. You spoke earlier to a reduction in the number of people that are getting tested. Could you maybe provide some numbers or help me understand that? How is the number of testing, how's that going down?
So I think, again, at the beginning of this pandemic, testing was a huge push for us. We had folks out there getting testing kind of all the time. I think at this point, folks are starting to think that maybe testing isn't as important because of the work that's happening with vaccine. And again, I think we're seeing a lot of relaxation in terms of some of those personal accountability measures as well. So in terms of specific numbers, I think we can look into that, but I think more so on full scale, we're looking to ensure that testing is ramped back up so that we continue to fight this virus.
Next, we'll go back to Jim Millward.
Hi. On the testing front, you say over 14.3 million tests, but that's barely one per person. We know people have been tested more than once. Obviously, PCR is the gold standard for diagnostic, but when you're talking surveillance, the technology's existed for months now, and it's been a battle with the FDA, but to get the cheap in-home tests that we all could use a few times a week or even daily, the cheap tests, not the $25, $50 tests. What is the state doing? Is there any advocacy on your part? Are you pushing for them? Are you trying to get either like some sample studies or anything along those lines?
So we always are working with the CDC and our federal partners to identify the best and most efficient way to test our population, and we'll continue to do so.
Perfect, thank you. Next, we have Grace.
Yeah, thank you. Based on the decreased testing, how many more COVID-19 cases, or how much more of a percentage increase do you believe is prevalent in Pennsylvania based on that decreased testing? So not getting that full idea of the scope of COVID cases.
Yeah, so again, we continue to see cases go up on a daily basis, so we continue to watch those numbers. And again, specifically when it comes to the testing numbers, we believe that people who are sick are getting tested. And so we continue to encourage folks who have symptoms to go out and get tested so that we can, again, follow where the virus is and understand where it might happen again.
Next is David Kaplan at WTIE.
Yeah, we've gotten a couple of reports of at least one facility here in Western Pennsylvania where an entire congregate care facility had been vaccinated, but a staff member had not been tested positive, and therefore entire floors were shut down. I'm curious if there's been any guidance or regulations. I know it's a thorny issue with whether or not staff members and medical workers have been vaccinated, but I mean, would you give any recommendation to a facility to try and limit patient contact with someone who's a medical staff member who hasn't been vaccinated? Again, I know it's a difficult issue, but I'm kind of curious where the Department of Health stands, what types of advice you're giving to facilities as it relates to situations like these.
Sure. Yeah, I think, again, this goes back to the importance and significance of vaccination. And of course, on our part, doing education with our providers and with those facilities to help folks understand the importance of vaccination in those jobs.
Next, we have Deanna Durante at NBC 10.
Back to the homebound and at risk. You know, here, I'm sure you know, we've been covering places like Lower Bucks Hospital and Grandview Hospital that had their first doses taken away because they weren't giving them out fast enough. And it took state lawmakers and federal lawmakers, as well as several letters and appeals to all of you, to get them more doses, which now they've got their 200 to 400 allotment that they'll start putting out tomorrow. But if you don't know how many people are really in this at-risk population, how do we know that that's enough, especially since those are facilities that have really dedicated themselves to serving their local population that can't go any further than those two hospitals?
Sure. So, yeah, absolutely. Deanna, just because I don't have the number here today doesn't mean we don't know. We continue, again, to work with our DHS agency as well as the Department of Aging to help ascertain what that number might be. And again, Southeast counties are getting 84,000 doses of Johnson & Johnson this week, which we hope will mitigate some of the issues and disparities there.
Next, we'll go back to Sean Hamill at the Post-Gazette.
Yeah, could you elaborate more on the survey that you've done for nursing homes? You said you're waiting to complete it. What are you waiting to complete? How long is that going to take? And again, why are you waiting to complete? I mean, I went through the survey. It looks like it uploads to a data set the way that it's laid out. You should have numbers that would get facility vaccination rates readily, I would guess, from that with a simple algorithm. What is the holdup?
So we're just waiting for all of the results to come in from all facilities so that we have the most comprehensive picture of what's happening out there and what the needs might be.
Thank you. Up next, we have Nicole Brambila. You should be unmuted now. Yep.
Sorry, hit the button. I don't know if I hit it twice. Yeah, so this is a follow-up to my question earlier, and thank you for taking my question. How is it, and this is probably going to come out a little bit more pointed than I mean for it to, but we've known since January of last year that they've been, Operation Warp Speed, since December, that and before, and the weeks leading up to it, that there's going to be this emergency approval. How is it that just last month you were coordinating with local AAA agencies about homebound seniors who, when you look at the statistics, seniors have been, bearing the brunt of the deaths in Pennsylvania?
Sure. So apologies if I misspoke. I think the coordination has been happening all along, but the actual action of working with those AAAs and getting those folks to call into the AAAs to get those vaccine appointments scheduled was what happened last month. We realized that by just having the Your Turn tool up, that really didn't reach all of the population we wanted to reach, specifically in those vulnerable communities. And so working with the AAAs helped us to mitigate that issue and ensure folks could schedule appointments.
And our last question today is going to be from Jamie Martinez at Spotlight PA.
Hi, thanks for taking another round. I just wanted to second Sean's questions about the nursing home survey, since that's information that I've been trying to get from the department by email as well. I mean, is the issue that the response rates have just been low, or what is the benefit of waiting until there's a complete picture? Because I fear that we're going to be waiting well into the fall at the rate, we've seen reporting happen for other areas of COVID data. So can you just explain what the holdup is with that information? Thank you.
Sure. So again, we are working with all of the nursing facilities that we have across the state to assess what their needs might be. There is a complete picture right now on open data. So if you look at that, you can see that data coming in. We're just waiting for a few more providers nursing facilities to answer the survey before we put that full scale out.